We convene local leaders on a variety of topics concerning our business community. This series is presented today by Dignity Health Mercy Gilbert Medical Center, Phoenix Mesa Gateway Airport, with further support by Cox Business. I'd like to provide each of our presenting sponsors a minute to share a few words. So we're going to start with Julie Graham of Dignity Health, and then she will turn it over to Shay Yoakum of Phoenix Mesa Gateway Airport. Julie, I think—
Sorry, I didn't unmute. Sorry.
You're all right.
Hi. Hello, everyone. As Sarah said, I'm Julie Graham with Dignity Health. I'm also on the Gilbert Chamber Board of Directors, and we couldn't be more thrilled to be sponsoring the guiding growth conversations with community leaders. And we're certainly happy to be participating in today's discussion. Just wanted to take a moment to say we're sincerely thankful for the outpouring of support from the community over the last 6 months. We've certainly felt loved and appreciated, and we have so many amazing stories of kindness for our frontline workers. But the fight really isn't over. We're here to remind everybody to continue to do your part, to wear your mask, social distance, especially over this Labor Day weekend, and use proper hand hygiene and stay at home when you're sick. And please get your flu vaccination as soon as possible. Our Dignity Health facilities are here if you need us, but that really isn't our goal right now, except for delivering those babies, of course. And a huge thank you to the Gilbert Chamber for your leadership during this time. You've really stepped up to help support the business community and continue to be a great resource. Now, I think Shay from Phoenix Mesa Gateway Airport has a few words.
Thanks, Julie. Phoenix Mesa Gateway Airport's always a proud sponsor of the Gilbert Chamber. I also get to participate as a liaison on the board of directors. Always interesting to hear what's going on in such a dynamic community. What an excellent topic today. Curious to see what the panelists have to say. As far as what's going on at the airport, we have been promoting Fly Healthy, Fly Safe, which is our motto, and providing a variety of sanitary and other aspects in the flying process to try to reduce the amount of anxiety and stress and improve the cleanliness to the flying experience. Aviation has been hard hit. I think that goes without saying. Our numbers, we're down 40% year over year in terms of passenger growth. That's actually pretty good. We're one of the fastest recovering airports in the country. Most airports, including our big brother down the street, Sky Harbor, are around 65 to 70% down year over year. So the industry has certainly been hit hard, but there are airlines that are positioned well to recover. We're optimistic Allegiant is one of those. They just announced a new route at a Gateway Airport to Santa Maria, California, that will start in November. So those are signs of optimism for us. The airlines and airports across the country are doing what they can to try and create some predictability and a safe, clean, healthy environment for people to travel through. As far as other stuff going on at the airport, variety of development projects going on, but most visible to the community will be next week we start construction on our new air traffic control tower. That'll be a very notable infrastructure, piece of infrastructure in the Southeast Valley. I believe it'll be the tallest building in the Southeast Valley. And we're excited. This has been a long time coming. It'll be a nice addition to the airfield. That's pretty much all I got to say. I'm really looking forward to the panelists. And Sarah, I'll turn it back to you, I believe.
Perfect. Well, thank you so much to our sponsors. We just simply couldn't do it without you, and we're so grateful. Administratively, as we run through today's webinar, you will notice a Q&A box at the bottom of your screen. If at any time you have questions, feel free to enter your questions in that box. You can also raise your virtual hand in the participant panel to the right. And with that, I'm going to turn it over to Dan Henderson, who's going to facilitate us. And I just want to say that the Chamber is so grateful for our partnership with the Office of Economic Development. The team we have here in Gilbert is second to none, and we're grateful for their leadership and their partnership, even in events like this. So with that, I'm going to turn it over to Dan Henderson.
Thank you, and good afternoon to all. So good to be with you all. And Sarah, could not do what we're doing without our partnership with the Chamber, and appreciate you and your leadership, the board, and certainly all the many ambassadors and stakeholders that are involved in the Chamber. what you do really makes a difference in our community, and we literally cannot do it without you. So thank you for your leadership. Thank you for your positive energy, and what a great segue into today's topic. And so I'd like each panelist to introduce themselves briefly, and as they introduce herself or himself, if you wouldn't mind adding 3 words or less to describe the last 6 months. And as we begin making those introductions, why don't we start? Let's go ladies first with Leanne.
Good afternoon, everyone. Thank you so much for the opportunity to be here today and to speak with you all, and thank you to the Chamber. In addition to my role with Phoenix Children's Hospital, I also serve as a member of the Board of Directors for the Chamber. So I'm seeing firsthand the work that they're doing tirelessly to support us. So I just want to start by saying thank you. For Phoenix Children's Hospital, I serve as the Vice President of the East Valley Market. So I oversee our operations that we currently have in place in the East Valley, as well as the growth we have underway in collaboration with Dignity Health. And in addition to my professional role, I'm also the mother of 4-year-old twins. So when I think about the last 6 months, 3 words or less is really hard. But I would say caring, flexibility, and innovation are the 3 that come to mind for me. So thank you.
Thank you so much. Let's hand it over to Libby. Libby.
Good afternoon. My name is Libby Mcdaniel. I'm the CEO of the Arizona Medical Association, and like Leanne, I'm honored to participate in the event today. The Arizona Medical Association, or ARMA, as we like to call it, is a professional membership organization across the state of Arizona that really serves the needs of the physician community. We represent about 4,000 physicians across the state. So the last few months have been really daunting, from a medical perspective, as all of the panelists can attest to today. In 3 words or less, I describe it as courageous for many of the acts that we've seen, very politicized, and resilient. Thank you.
Thank you, Libby. Appreciate that. Next, why don't we go to Becky?
Sure. Thank you. Thanks for having me today. So I am Becky Mclaughlin. I work for Banner Health. I support human resources for our Arizona community delivery region. So our 12 facilities here in the acute care setting. So I also am a mother of 2, and there's several words that would come to mind as I think about the last 6 months personally and professionally, but I'll sum it up with expect the unexpected. Thank you for having me.
You bet, and that was a great way to stay within the 3 words. So thank you very much. Next, why don't we go over to Mark. Mark, good afternoon, and hand it over to you for some brief introductions. Mark, I think you're muted.
There we go. Hey, thanks for that. Thanks. I'm Mark Sutter. I'm the CEO of the Dignity Health East Valley. Primary responsibilities are Chandler Regional Medical Center and Mercy Gilbert Medical Center. And I appreciate the upcoming partnership we're having with Phoenix Children there at Mercy Gilbert Medical Center. And then we've got lots of urgent cares and other freestanding EDs and a bunch of other stuff in the East Valley as well. And I coordinate those. I guess I've got young kids, even though I got gray hair. I started late, and so I do have young kids, and it is a incredible challenge to work as hard as we have during this period of time at the hospitals, coming in every day and trying to make sure we're providing the services for patients. But then going home and there's no relief. I was up late last night helping my daughter, with her homework, and this is very challenging for all of our employees and for everyone now that's certainly dealing with this pandemic and the impact it has to families and to businesses. So I guess the 3 words that I would use is, the first and foremost is challenge. And the second one, with every challenge we have found and across the United States, everywhere it's been impacted, and you'll hear it from each of the participants here today, is we found opportunity. We found ways to not only address the challenge, but make ourselves better while we were doing it. And the third is proud. I'm just absolutely proud of the response in the United States. I'm proud of the response that we've had here in Arizona. I'm proud of the response we've had here in the East Valley. We have done an exceptional job, and someone mentioned earlier, politicized. You absolutely believe all of this is politicized, but I will assure you that the folks that are dealing with this day in and day out should be commended, and I'm very proud to work and support those caregivers.
Thank you. Thank you, and well said. And then finally, Michael, are you in a position to make any comments?
So this is unexpected for me. No, I would echo what's been said and just really appreciate, especially Julie, I think the introduction and Mark and Becky, Leanne, each of you is, I think as you have, and Libby just mentioning, I think the challenges over the last few months, I think each of us have been walking a path that's not been walked before. I think the words spoken have been excellent. I've really looked forward to this panel because I think there's just a wealth of knowledge that's about to be shared and from a lot of different views and angles. And I think for me that the three words that come to mind for me would probably be similar to many others of challenging, and maybe it's two words, but team building. I think that I've seen teams come together that have amazed me, and teams maybe who don't normally work together, organizations that don't normally work together. So it's been inspiring, and so I guess my last word would be inspiring, because I've been able to see the best of others. Thank you.
You bet, and thank you. Let's see, and I do believe that Becky is sitting in as a panelist there for Michael, but I appreciate those comments. And so as we begin the panel discussion, I'd like to start with really the topic at hand. And we know our hospitals and healthcare workers have been on the front lines of the COVID-19 pandemic for months now. Can you share with us what the last few months have looked like for your organization and what you anticipate the next few months to bring? And I'll just leave that open to any of the courageous speakers here today to take that on first.
Do you want me to start?
Please.
Okay. Well, we were one of the first to see COVID patients. The first patient within Dignity Health was at Mercy Gilbert on the 20th of March. I don't know, that was actually the first in Dignity Health, and I'm not sure, maybe Banner can share when they first saw the patient. So really that first 90 days of COVID was, it was challenging from a planning perspective, just getting all of our house in order and updating our surge plans and making sure our inventories and PPE and testing was built up. Luckily, we had a good 90 days to work in that zone to prepare. And really our census overall, we only had, I think, around 14% of our census was PUI, meaning they're under investigation, are positive. Patients, our census was about 14% was COVID, PUI are positive, and only half of them ended up being positive. Then we moved into this, the business opens up after that 90 days is about May 16th. And then there was another 30-day period that we didn't really see much. Didn't see much really elevate in the hospital. And then around the last week in June, that was the beginning. About June 19th or so, from the Dignity perspective, is when the surge really started to take off. And it was about a 20-day rise in census, and it rose pretty fast. In fact, it got up to about almost 30% of our census, overall census, was COVID related, and almost all of it, 100% of it was positive COVID. So the real deal stuff there. And we were in that a period. I will tell you though that, and Banner I'm sure can comment on this, and maybe even Phoenix Children's, is that particularly in the East Valley, we're used to surges. And so it wasn't really alarming for us to get over 100% of our licensed beds. We budget over 100% of our licensed beds. The only thing that was challenging for us is when the surge hit. It was in the summertime when we have less staff. We're used to surges in the wintertime when we have the staff available. This one hit us at a time that we had all of our PPE, all of our testing, all of our processes ready to go. It just took us 2 or 3 weeks to get staff to a sufficient level, and that was really demanding of our staff during that period of time. And then we saw about, we're now going on 60 plus days since our peak, consistently declining. It's declining a little slower than what it rose, but now we're at levels, lower levels of hospitalization than what we saw at the beginning of this. In March, we're down to about only 7% of our census is PUI positive, and less than half of that is positive. So we're really back to business as usual in all of our areas. We were fortunate, and I think Banner can comment on this, and certainly Phoenix Children's, we were fortunate. Even during that surge period, we were able to keep surgeries going. We were able to keep care of all of our other patient needs, our emergency departments, everything. Even during that busiest time, we were able to do that. I think that was really Yeoman's efforts in planning and organization. And again, a lot of people coming together with a lot of innovation and just figuring out for the sake of the patients. So that was kind of our experience in the last 3 or 4 months.
Thank you, Mark. Appreciate that. Libby, Becky.
Yeah, I'm happy to piggyback. Do you want me to piggyback on that, or did you have another question?
No, there are other questions, but we'd love to hear from you as well.
Sure, thank you. So from the physician perspective and us managing an organization that's really focused on the physician community, that was our first and primary focus when this hit back in March, is making sure that the medical community had what they need in order to provide optimal patient care as best as possible. So we very quickly all of us have had to pivot, right? As we've been in more of a reactive mode early on, as opposed to proactive. But we were able to secure a relationship with an outside vendor to get PPE, which was critically important for our medical community to be protected as they saw patients. As Mark mentioned, staffing was a significant issue. We had multiple conversations on both the state and the federal level to try to get the staffing needs addressed. And thankfully, we got some help federally on the staffing side. The other piece of this is we've seen kind of over the course of the last 5 months, this has really taken an emotional toll on the medical community, the folks that are treating patients day in and day out. They've never experienced something like this before. As everyone said, it's unprecedented, but to have management be so complex of these patients, and then see so many people, dying of something that it's hard to get a grip on that. So one of the things that our organization is actually doing now as we look to the future is putting together a peer support program to make sure that those in the medical community have someone that they can turn to as a resource to just simply, vent, talk about the emotional toll and the other things that this pandemic has impacted them. The other piece of this, outside of the focus on the medical community, has really for ARMA been a focus on public messaging. There's a lot of misinformation out there, and we've taken every opportunity we can to try to share as much information as we have, especially about preventive measures, because I think that messaging is critically important, and we're continuing to do that and work with stakeholders as part of the process.
And I'll just add from a pediatric perspective, because our experience has been slightly different than that from our adult health system counterparts. And so Children, very thankfully, have not been impacted to the extent of adults by COVID. However, really a lot of our focus has been ensuring that we create a safe environment for our staff, our providers, but then also our families, so they don't delay necessary care. That's been a really important message that we've been trying to reinforce through our primary care network of providers, but then also through our specialists as well. Children have ongoing healthcare needs that families are fearful to come into the healthcare environment. So a lot of our work has been on messaging and educating families to make sure they're not delaying that necessary care. As well as information began to surface about the multi-inflammatory syndrome, getting our specialists engaged in that work to help educate and inform families, because I think a lot of what we've been hearing and absorbing has evoked a lot of fear for people. And so just trying to make sure they have the correct information and know what to do when they have questions. So in addition to what everybody else has shared, our pediatric perspective has been a little bit different just because we haven't seen the surge to the extent of COVID patients, but rather it's been focused on making sure we're not delaying that care that can have long-term implications for children.
Dan, if I could just add from a Banner Health perspective, I echo very similar comments of the trends as Mark shared with Dignity. So this was a time of just true transformation for us. So we found as we had kind of that initial flow and then a little bit of that downtime, that was the time we were trying to be as proactive and transformational, knowing what could be to come. And certainly it did hit. So it was really nice to see the organization, the community, our partners at this, with Dignity and others in the market come together to say, hey, how are we going to do this? I would echo the similar comments about staff. Staff are tired. So right now we're really focused on, if you think about today, we're focused on giving our folks some time, giving them a break, making sure they're taking some well-deserved time, taking care of themselves. So one of the initiatives we have right now is really focused on resources for living, financial resources, self-care, child-care, just wellness initiatives to help our teams feel better and kind of get back on track and know that we're there to help them as we're kind of in this lull, as we're thinking about winter and what does winter have in store for us and how do we plan for winter and just making sure we're taking care of the team.
Becky, thank you for that perspective, and certainly Leanne and Libby, appreciate you adding perspective. Mark, great comments. We did receive a question in the chat, and I thought I'd just real quickly take a minute to address the question. As school boards consider reopening school buildings, any advice for keeping students and staff safe? I'll leave that to whoever feels they're in the best position to answer that. Real quick look, it looks like Libby's unmuted. So Libby, if you're brave enough to jump into that, you're welcome to, but whoever's most comfortable addressing that, please.
I mean, that's a really challenging question. And I know that the state has put together a list of benchmarks just to make sure that we're meeting certain metrics before the schools open. But I think that we are preaching the same thing, even in schools, around social distancing and mask wearing as much as possible. I don't know if others have other comments.
Well, just I think I almost have to speak a little bit from a parent right now that's dealing with a kindergartner and a fourth grader and a sixth grader at home. This at home learning is not something that's sustainable. They're being away and not social interactions. It has a mental stress on kids. And so this just really, we need to get the kids back to school as soon as possible. And I know I'm speaking to a business community here. I'm sure all of you will echo that your productivity of your workforce is significantly hampered during this time of stress with your employees having to deal with all of these things and not having kids in school. So with that, certainly we want to get as Libby mentioned, want to get the kids back safely, but certainly there is plenty of examples of how to do this, and plenty of schools that have already done it here in the state and across the nation successfully, and so should feel very comfortable in getting the kids back to school safely if we follow those precautions. I guess also, and this is, we can't say we can necessarily say from a clinical standpoint, but one of the indicators that I think we're just about ready to hit is the percent positivity testing rate, and that's a measure of testing. So, although we haven't really been pushing testing for the asymptomatic patients, in fact, you can't come to us and get a COVID test if you're asymptomatic, but you can get them at CVS and Walgreens and others. And I assume that at least from an epidemiology standpoint, that's a good thing because they're using that as one of the metrics. So I would say if Arizona has one indicator to get us back going again and feeling more confident, go out and get tested. I'm not sure that there's a lot of clinical application for it, but it does help with these indicators. Will help get the kids back in school sooner, and then will help our workforce get back to work more productively sooner. So maybe some of the others can comment on that as well. So,
excellent insight. Anyone else care to comment or add to the discussion?
I would just add, I do not envy the role of school superintendents and school leaders these days. They're just tackling some very, very, very difficult decisions. And from a pediatric perspective, the American Academy of Pediatrics did come out with a statement in support of getting children back in school. And I know that's looking at it from the children's perspective. They are shown to be at lower risk. We at Phoenix Children's are seeing the impact of the mental health of children from being out of the school system. So as Mark said, that is real. We're seeing that. And so, we all want it to be a safe environment for everyone in the schools. The children aren't the only people there. And so we certainly understand that, but hope that we can find a solution that will provide a safe environment to move forward in that regard.
Thank you, great perspective. In balancing sort of some of the questions here as well as some of the panel questions, I'm going to go back to the some of the panel questions real quickly. Recently, the Arizona Chamber of Commerce and Industry and the Arizona Medical Association launched Be Safe, Be Open Arizona, or AZ, a partnership to promote the critical safety measures needed to slow the spread of the coronavirus and protect the state's residents, employees, and healthcare heroes on the front lines of fighting the pandemic. Libby, as this is an effort from your organization, what can you tell us about this initiative?
Thanks for letting me speak a little bit about it. We're really proud of the work that we've done with the Arizona Chamber of Commerce. We know that in addition to the healthcare field being impacted negatively by COVID, that really our business community has been devastated by it as well. And we are really looking for ways that businesses can open back up safely. So essentially what this initiative is we've developed a website, besafebeopenaz.com, that provides some basic parameters on how to reopen safely as a business, but it also provides materials that you can download and print with your logo and other branding to say you're a business that actually adheres to the safety guidelines that are being promoted across the state, and you want your customers to be safe as they come back to your business. So signs like no shirt, no shoes, no mask, no service are available. Also, good health is good business. These are all little taglines that I think we can work with the business community to promote, to say that we're doing this in partnership with the medical community and safely.
Excellent, thank you. I've got a question from the panelists here. Panelists are interested in knowing, or rather the audience is interested in knowing whether the treatment of COVID patients negatively affected hospital income streams. What did reimbursement from third parties look like during this period?
Well, I guess I could start and then others could add in. First of all, the overall impact of COVID, it's not just the treatment of the patients. Remember, we had executive orders that limited our ability to do surgeries and other types of things that was a significant negative impact to our hospitals and other health providers. And so that was 2 or 3 months of real red ink across the board. And we're talking in the millions of dollars of things that we had to dig out of. What did the CARES Act, CARES Act, for most of us, it bought maybe 1, maybe 2 months of getting us out of the red, and then we're right back in that situation again, unfavorability to where we had traditionally been. And fortunately, when the businesses opened it up in May, we were able to manage all those surge of patients and still maintain surgeries and still do the things that didn't delay care. And financially for us during those periods of times, we were able to recover. And right now, I'm not saying that we're completely back. We still have people that, as I think Leanne mentioned, and maybe it was Becky, that there was still some hesitation out there in the community about coming to the hospital. And there is still people out there that delaying care. So I would emphasize to folks, not only just from your own personal health standpoint, but we're a safe environment, and we're absolutely prepared to take care of your needs and take care of you moving forward. And it doesn't help us out at all if you delay care, because what's going to happen is that we're getting into the cold and flu season. We might see a second surge. And if you delay care, you're going to come in the emergency department in a critical situation. And that's exactly what we saw. And it's going to make the work for us and the capacity constraints that we have even worse. So get the care you need right now. So again, financially, I think right now we're in pretty good shape again, but this is a pretty big hole that we had to dig out from, at least from the hospital and health system standpoint. And I'm sure medical practices, oh my goodness, those businesses really were hit hard and are struggling. I'm sure Libby can comment on that.
Thank you, Mark. Becky, any thoughts or any additions?
Yeah, again, very similar. I would say, our emergency department flow is certainly slower than normal this time of year. However, as Mark stated, the patients that are coming are critically ill because they have delayed, they have waited, and they're needing to have much higher level acuity of care. So again, we don't want you to delay. We are safe, as Mark said. So very, very similar in that space.
Thank you. Leanne, any additional perspective to offer?
No, I think that they covered it well. For the Children's Hospital, it was a significant impact for us during the time that we were unable to do scheduled surgeries. And children don't have things that you would consider elective, right? They need those procedures to occur. And so we were very concerned about the impact of delaying that care for them. We have aggressively worked since the executive order ended, allowing us to resume those surgeries, to get those children scheduled, open up as much as possible to make sure those delays were minimized to the extent possible. So that's certainly been helpful. But just as others have said, it does appear that people are delaying some of the healthcare needs that they have. And it's just really important for us to make sure we can't say that message enough, make sure people are seeking the care when they need it.
Yeah, Dan, if I might add, this is Becky. When you think about our visitor restrictions, we know that our patients might have hesitations to come in for surgery or for care because they may not be able to bring a visitor in certain situations. So we are certainly looking at our visitor restrictions, and we know, again, we're just really trying to articulate to the community and our partners, it is safe. Our team is there to take care of you. Our team has had to step in as part of the family in many cases, especially with our COVID patients. So we're here for the community and certainly want them to come in.
Thank you. During the pandemic, Governor Ducey implemented new measures to ensure healthcare access for all Arizonans, including an executive order requiring healthcare insurance companies to expand telemedicine coverage for all services that would normally be covered for an in-person visit. He also signed legislation increasing Arizona healthcare cost containment system, or access essentially provider rates for hospitals, doctors, and more. What impact does this have on your healthcare or on healthcare now and into the future? Perhaps we can start with Leanne.
Yes, so Governor Ducey's executive order around funding for telemedicine has been tremendous. That has really enabled us to continue to provide care in the safest environment without people having to come in, even though we have many safety measures in place in our environment. And we were actually at Phoenix Children's able in early March through the work of our IT team to build a telehealth platform where we shifted over 6,000 patient visits to virtual care in 1 week. And with that, that allowed us to not delay that care that children needed. And it has been tremendous. We have some specialties who have gotten up to 90% of their patient visits done effectively through virtual health. And others, of course, have to be done in person, but it has been a tremendous asset for us to be able to do that. And we've even seen families who, due to distance, not COVID related, but the provision of telehealth has really improved access for them, where it really was a barrier for them for travel and other locations to be able to come to the Phoenix area for their care. So we are incredibly supportive of the funding for telehealth to remain after COVID. We've seen the impact of it. We've seen the quality of care we've been able to provide in many circumstances through that. And we see that as a silver lining of the COVID experience, that I think it's really enabled us to leverage technology to expand access to care.
Thank you, Leanne. Becky, any thoughts or comments? Sorry, Libby, I'll get to you in just a minute. My apologies. Becky?
Yes, same. So we're obviously using the format and looking how can we continue to expand, what are other innovative ways we can use. So certainly supportive of it coming in. It's been extremely helpful for those care settings and looking for those future initiatives.
Thank you, Becky. Libby, thoughts or perspective?
You know, telemedicine was around before COVID, but it wasn't being used anywhere near to the extent that it is now. And I think it was really forward thinking of the administration to remove the barriers that telemedicine currently had pre-COVID, so that people could utilize this in a variety of ways. There were barriers around reimbursement, there were barriers around the types of platforms that you could use, and really all of that was listed as a way to make sure that people continued to address their healthcare needs. We see, and as all of the panelists have said, telemedicine has skyrocketed since March, those types of visits, and that's critically important. You know, as we move and look towards the future and what this might look like, we really see telemedicine as a way to supplement in-person care, not necessarily substitute it for all types of, diagnoses. And so what we're doing is putting together guidelines and some kind of best practice recommendations so that we can work with the insurance community and others to try to make sure that telemedicine is here to stay for the future, but that we do it in a really thoughtful and strategic way.
Thank you, Libby. Mark, anything else to add?
No, I'd just add to that. I think that's a good point, Libby. It was definitely helpful during that period and will be helpful as a supplement to care moving forward. We saw about a 60% decrease in in-person visits during that March, April timeframe, and about a 15% increase in telehealth visits during that time frame. For some practices like our family medicine, a lot of that has come back to maybe about 10%, 5 or 10% less than the pre-COVID levels. So they're coming back in person, and the telehealth is dropping off. it had a 15% increase. Now it's still about 5 to 7% increase from what the utilization was before. And it's a little bit specialty dependent, as I think Libby and Leanne were mentioning. It works for family medicine, it works for some things, but doesn't work so well for cardiology, doesn't work so well for some of our proceduralists and neurologists, etc. So those types of things, we've seen some of the telemedicine still not as utilized. Interesting enough, though, there's also a lag by payer. I guess you would expect some of our older, those Medicare patients, to be bouncing back, and most of them are bouncing back to in-person care, and they're about at the levels that they were before in in-person care. But surprisingly, we're having a really difficult time with our access patients, our Medicaid patients. They're still lagging in their utilization, and maybe that isn't surprising because of their lack of getting to different types of technology. But a lot of this technology is a smartphone, and so maybe some of those devices aren't as limiting, but we're still seeing some differences from that standpoint. So that's just some of the things we're seeing in the telehealth space.
Thank you. Excellent responses. That's really, really insightful. Switching gears a bit, the pandemic has taken a toll on our families and certainly our frontline healthcare workers. What do you anticipate the impact of this experience will have on those currently in the workforce? And what impacts do you think that might have on our future workforce pipeline? Why don't we start with Libby?
Thanks, Dan. As I mentioned before, the current impacts on the workforce are that we are seeing significant concerns around staffing and just the emotional toll that this is taking, from a healthcare perspective on our medical staff. But I still think that healthcare is such a rewarding field, and you're seeing the heroes every single day on the front lines that, we're certainly not anticipating at this point any negative trends around workforce. I'd be interested in what the other folks on the phone have to say around potential trends as it relates to the future of the healthcare workforce.
Yeah, absolutely. Becky, I saw that you came off of mute. Any thoughts or perspective that you'd like to add?
Sure, I'd love to jump in. So from a Banner Health perspective and potentially similar out there, we certainly have seen some turnover. I'd be lying to you if I said that we didn't. We've had, July was a tougher month. We saw some increases, but what the trend
Becky, I think we lost a connection, it looks like, with Becky. Perhaps I can transition over to Leanne. Leanne, anything you'd like to add as Becky transitions back into this format?
Sure. So I'll just talk a little bit about, with Phoenix Children's, we have a little over 5,000 employees, and we've seen just immediate impacts of our non-clinical team. So the folks are not involved in direct patient care. We have shifted predominantly to a remote work environment. And it's something we're actively talking about as far as the toll that takes on your culture and how you continue to maintain positive work environments and team, and supporting our staff through that. With the reductions in volumes that we've seen, especially during the time when we had the scheduled surgeries postponed, we did really value maintaining our staff. So we implemented a pay protection program that's actually still in effect today for staff who their shifts were impacted and they weren't actually working their full FTE. We guaranteed their pay for their full FTE, and we're continuing to do that in some of the smaller areas today where we've still seen some impacts. So it's just been really important to us to continue to make sure our teams feel valued, because we do feel like COVID will become a thing of the past, and we will get back to full steam ahead in all regards, and we need them. We need them as part of our teams. We need them to feel safe and confident in that. So that's been a real focus for ours, but we're also working a lot with our wellness teams on resilience. And you know, many of our employees, just like we talked about today, are parents, and they're kind of burning the candle at both ends right now, where they've had family members impacted by COVID. And so all of that weight is, they're carrying that. And so we are really focusing on support programs to try to support their overall well-being during this, because it has been a bit of a marathon, and we know that we need them to continue to bring their full selves to work every day. So how do we support them through that? So that's been a real focus of our efforts at Phoenix Children's, just trying to make sure our workforce stays on board with us, but then also well just prepared and in a good state of mind so they can continue to bring their best every day.
Thank you, Leanne. Appreciate that. Becky, I see you're back. You mind if we come back to you real quick? And
Absolutely.
Yeah, please.
And just like that, you have healthcare turnover. No, I'm internet issues perhaps, but anywho, what I was saying is as we've looked at trends, the trends are truly our team members are assessing their personal and professional goals, just like all of us are, as things have just changed personally and professionally for everybody. So we have had certainly some turn to in our healthcare workers that they've left to be closer to family because somebody was ill. They've left because of scheduling. They've left because a spouse or a partner has lost their job. Like there's many reasons personally why our team members are leaving. So I will say though, our pipeline's looking great. We're hiring. There's folks out there. We've got you know, so we did have some travelers supporting us through the last couple months, and some of those folks have said, hey, I want to stay here. I really like this place, and I like what you guys have to offer, and I want to stay. Now, on the vice versa, we've had some team members who have left to be travelers and to go out and help the broader. So it is a little bit of an interesting time, and I'm so thankful and proud to work for an organization that is focused on our team's well-being and taking care of themselves, so we can really think through how do we upskill, get the right people in the right place and at the right time.
Great perspective, Becky. Thank you. In the interest of time, I'm going to transition to another question, and we've got some questions coming in from the Zoom webinar chat as well that I want to make sure that I address. In November, voters will vote on Proposition 207, which could legalize marijuana and growth of marijuana plant in the state. Should this ballot measure pass, what impact do you anticipate this will have on your services? And it looks like Mark is the only, or rather, yeah, Mark is the only one unmuted. So why don't I hand it over to him real quick?
Well, you know, I don't think we have, at least from Dignity Health standpoint, have an official position on this. There is many concerns from a public health standpoint that we would like to be addressed in evaluating this. Quite frankly, of the things that we're dealing with, this isn't on our top 10 list. I mean, there's lots of more important issues for us that we're dealing with. But, you know, as it's presented, there is public health concerns and, you know, what's going to happen with, traffic DUIs, you know, different types of things that will have an impact to substance abuse, those types of things. And, you know, there is studies that would support and studies that would say there's not a big impact to that. So they go back and forth. But one thing I think I can speak, since this is a business discussion here, is our workforce. And the testing of this, if someone's impaired, is not, it's challenging and will be challenging for us. And so from a workforce standpoint, productivity, testing, if they're impaired, I think there's many hurdles for us, from that standpoint. But like I said, I don't think we've established an official position on this, but there's a lot of questions to be raised from both the workforce standpoint and public health standpoint before we'd feel comfortable in setting a position.
Thank you, Mark. Libby, I don't know if you have any thoughts from an association perspective on the matter.
We do. We actually just talked about this at our board level 2 weeks ago, and ARMA unanimously took a position of opposition to Prop 207 for many of the reasons, that Mark mentioned. I mean, there's limited research and really no good research out there on the long-term effects of marijuana usage, in terms of how it affects your development, mental, physical, everything. And the other piece of this, as he alluded to, is detection of, marijuana from a workforce perspective. Even, driving under the influence. We don't currently have a good mechanism to be able to detect marijuana in somebody driving under the influence of marijuana. So those are some of the things that other states have battled and are currently dealing with. And we definitely fear that we're going to be in the same boat if this passes in November.
Thank you, Libby, and thank you, Mark. Appreciate your perspective on that. In Gilbert, we have a strong business community and can often come together to support the advancement of issues and otherwise support one another. Could each of you briefly share with us some ways our local business can support our local healthcare organizations? And why don't we start with Becky?
Certainly. I will just share our heroes love to hear from you. They love to hear from you, see the cards that have been written. They love food, so don't discount food, because we certainly love when we get fed. But honestly, the community has been overwhelmingly gracious already, between painted rocks and chalk and just reminding them every day as they walk in that they're valued and they matter. So truly just continue the great work, because you guys are already doing it, but they love food. So if there's any deliveries, we'll be glad to take them.
Thank you, Becky. Leanne, anything you'd like to add?
I would echo everything that Becky said. The outpouring of community support has been wonderful. Our heroes on the front line, it really does mean a lot to them. They feel that. One thing I would add that our Children's Hospital Foundation has developed a hardship fund, and the funds raised through this have gone to help support our families of our patients who they've experienced impacts of COVID, whether that's loss of employment, housing insecurity, inability to pay their bills and whatnot, which then impacts the child's ability to get the care they need. Many of these families are, battling cancer with their children and things like that. And that fund, which has been supported by the community in an amazing way, has really allowed us to support families so they can be present for their kids and make sure that their care is not disrupted. So I would say that's another way that both our business community and our citizens have just really shown up for us. And I just want to say thank you for that.
Oh, that's wonderful, Leanne. Thank you for sharing. Mark, anything you'd like to add?
No, I think everything that was mentioned, our community really supports us well, and I just appreciate everything that they've done. I will say how the communities can continue to support. Remember what we talked about today is, good business is staying healthy and making sure that you're following the guidelines, and what Libby mentioned and what they're doing with the association, I think is fantastic. Just making more and more people aware of the importance of that, because if we stay healthy, we're going to keep our businesses open, and we're going to be able to handle any surges that come our way. So I definitely say so. Get your flu shot. I guess, if you want to get a COVID test, that at least will help get our kids back into school. And, watch the guidelines and just pay attention to the guidelines. We don't listen, we like to be here when you need us for an emergency, but quite frankly, we don't want to see you in here. So, keep you and your workforce healthy.
I love it. Thank you. I'm going to lob this one over to Libby. Before we take questions from the audience, could each of you share your organization's top 3 to 5 priorities for the next 12 months?
Sure. Vaccinations are at the top of our list right now for, between now and February. We really are encouraging as many people in the community to get vaccinated against the flu as possible for all the reasons that we talked about earlier. So heavy emphasis on messaging around vaccination. We also want to continue to work with stakeholders to provide resources for the healthcare community, some of the things that we've talked about earlier. And then I would say that the third priority is taking a look at legislation to address some of the things that have come up during COVID, things like liability, telemedicine reimbursement parity, even, as I mentioned, the peer support program. There are some questions around what could possibly be disclosed in that type of a setting. So there's a lot of things that we're dealing with, and ARM is an advocacy organization, so that's where one of our primary focuses is around advocacy for the future.
Thank you, Libby. Let's go to Leanne. Leanne, top 3 to 5 priorities over the next 12 months?
Yes, so similarly to what Libby mentioned, one of our top priorities right now is just reinforcing that message that we're open for care, we're safe. We internally feel like we're actually safer at work than we are out in the community with all the measures we have in place. So first and foremost, do not delay care. If you have children, make those well child appointments. It is well worth your time and should be a priority for that. In addition to that, Phoenix Children's, we're really focused on growing and expanding our access. And so specifically here in Gilbert and in the East Valley, we are rapidly growing our services, whether that's expanding specialties we have available today or adding services that we hadn't previously provided. So that's a key focus for us. And to do that, we're also recruiting and focusing on retaining our staff to be able to deliver that care. So actively recruiting additional providers to come and help meet the growing needs of this community, as well as our staff to support that. So those are our top 3 priorities at this time.
I love that. Thank you, Leanne. Let's go over to Becky.
Absolutely. So top 3 out of the many, but top 3 certainly around our team and team retention, similar to what Leanne had shared, making sure our teams are well, they're getting their vaccines, our community is getting our vaccines. So very similar in the team bucket of self-care. I would also share just working through just what does winter, predictive analysis, what will our winter look like? How do we ensure we have the right staff? How do we make sure we have enough PPE? How do we, kind of what I said from the beginning, how do we plan for the unexpected and just being prepared to do that? Those would be our main top ones right now.
Thank you. And Mark?
Well, those are all great and certainly things that we're emphasizing as well. But we're getting back to business. We are getting back to the priorities that we had pre-COVID and really focusing in on those, because those will help us not only to position us for the future and meet the community needs, but it'll also make us better to respond to surges like COVID in the future. So our top priority is increased capacity, get these construction projects completed. We've got, a $200 million construction project that got delayed a little bit. So it's 100 beds there at Chandler. And then we've got the one that Leanne mentioned is a, $250 plus $280 million project with the Women's and Children's Pavilion to add those services and resources and really increase the capacity that we have here in the community. The second one would be just increasing the services, making sure we're bringing more and more services locally, that complex care that can be right around the corner from you. And we're doing that at both Mercy and Chandler campus. In fact, at Mercy, just adding the neurosurgeon. So Barrow Brain and Spine, most of you know that the Barrow Neurosurgery name and brand and that excellence. We've had 6 Barrow neurosurgeons there at Chandler. Now we've got one that's going over, and they'll all rotate, so we'll be able to provide that service. Leanne probably could mention a whole litany of subspecialists that are on the campus now of Mercy in the Phoenix Children's Medical Office Building. We're so excited about that, and most families now don't have to drive downtown to get that type of care. And we can just a list of it, but that's an absolute priority for us. And the third is just expanding access. And when I talk about expanding access, it's not just you know, bricks and mortar. We're talking about improving our access to telehealth, telemedicine, anything. COVID, it gave us a great opportunity to pressure test some of that and really accelerate some of our plans in those particular areas to really make the experience and improve the access to everyone. So those would be the three things, really just getting back to the fundamentals that were so important priorities for us before the pandemic.
Excellent, thank you. Those are fantastic priorities, certainly from a community perspective. We thank you all for what you're doing. From an economic development perspective, I think I might have heard some pretty neat projects on the forefront for each and every one of you. So that's also very exciting for our community to bring in those services. If you will indulge me, I know we're a little over time here, but we've got a couple of great questions that I'd like to pose over to you. Let's see, going down the question list, we got a question. It seems to be directed at PCH. What type of census has PCH seen regarding positive or PUI cases of COVID? The question went on to suggest that there was a recent question from local media to the governor regarding Arizona being the second highest in the nation for number of child deaths related to COVID. Any thoughts or perspectives that you'd like to provide on that front, Leanne?
Yeah, so I will say the timeline of patient volumes that we've experienced at Phoenix Children's, it aligned very closely with what Mark shared earlier. As far as early on when we went into the quarantine and the community lockdowns, we had very, very low volumes at Phoenix Children's. We were seeing low negative test in our, low positive test rather in our emergency settings, in our clinics. But then as we moved into June, that scenario did start to shift a bit. And we did have, and we still actually have operational, a special pathogen unit at our hospital. So we created a unique environment to be able to care for these children who were positive for COVID. And make sure that we were able to maintain a safe facility for all the children who were not positive. And so that unit, we actually expanded to 3 units during the peak, which was really towards the end of June. We have since seen that decline very, very nicely. So the measures that we've talked about in the community, masks, social distancing, reducing gatherings, we are strong believers that that has had a positive impact on what we're seeing. Our positivity testing in our clinical settings has dropped significantly. So we're seeing all those right trends. We still monitor it very closely to ensure that we're moving in that direction. But relative to our adult counterparts, our volume has remained very, very small compared to the impact to adults. But it certainly hit a surge in June.
Thank you, Leanne. Appreciate that, and thank you to our audience for that question. I've got another question here for our advice for our students that are seeking a career in healthcare. Any trends in medicines or anything that you'd all like to mention to I don't know, for those students that are seeking that career in healthcare? Any perspectives, any advice, any input that you might have for them? And perhaps we start with Libby on this one.
Sorry, I had to unmute. I'm not sure what the future is going to look like in this area. I can tell you that, as I mentioned, as we've all had to pivot, medical education has had to pivot as well. And that's an area that's continuing to evolve. So I think there are some things being done right now in medical education that's very different than, how education was done previously, that will continue for the future. But those are all being piloted at the moment. But I don't really have any hard data on what other trends might look like in healthcare.
Thank you, Libby. Let's go, Leanne. Becky, Mark, any input that you might have for those students that are seeking a career in healthcare?
Well, I guess Becky could probably answer this better, but I will say, those careers that connect healthcare with technology and any type of components, probably your future is going to be very bright. That's going to be a very expanding opportunities moving forward. So any fields that connect those two will be helpful. And then before I throw it over to Becky, I say, hey, don't forget about administration. You know, we need good leaders out there too. And people always, whenever you see a TV show in healthcare, the administration is always that really bad guy, negative. You know, hey, they're important. Leadership is important. And so I would say that other than the clinical fields, probably many of the folks on the phone here are on a little bit different track. And that is a calling as well. I mean, it's not your traditional business calling. And, you know, for those that have that calling, I would echo that, that's an important one as well. We need good leaders. So Becky, you probably have a better answer than I do.
Becky, please.
Yeah, no, that was fabulous. I would just say if they have a passion, the advice is still move forward. Why change the direction? There's still going to be a future in healthcare. It might look a little different, but what's cool is it's going to include technology and it's going to be innovative. And I would say continue down that path. Yeah, everything looks slightly different today, personally, in our lives as well. So I would just say keep them down that path and continue to mentor and develop them.
One thing, if I could quickly add a little plug here, if you do know people who are specifically interested in a career in pediatrics, we often are challenged with finding people who are experienced in that field. And just this past year, we entered into a strategic partnership with Arizona State University's School of Nursing on a pediatric nursing program. So the students in that program get a significant number of hours in the pediatric setting, and we have just hired out of 2 classes there into our pediatric nursing positions. So if you know anybody interested in nursing and pediatrics, I highly encourage them to check out that program.
Well, I am going to interrupt at this time, and I want to say on the workforce side, we're very fortunate to have each of these hospitals in our community. You have been a partner with us in our career shadowing and mentorship program and been available to come out and speak to students and educators and support our Tutors for Teachers. So we're grateful for your partnership and your investment in Gilbert. And with that, I want to thank each of you for serving as panelists today. And I want to thank our fabulous moderator, Dan, wherever his space is. But there he is. There he is. Thank you guys so much for the conversation and contributions today. We've learned so much and grateful for all that you do to support us. And with that, I'm going to end it. And thank you so much. Have a good one.
Thank you.
Thank you.
Thank you for having us.
Thank you.